The Royal Australian College of General Practitioners has urged a government inquiry to cut migration red tape, which is holding back international medical graduates from practicing in Australia. With me now, I've got Dr. Nicole Higgins, President of the Royal Australian College of General Practitioners, to discuss the issue. Nicole, thank you for joining me today.
Pleasure, Dan.
How difficult is the current process for international medical graduates to practice med in Australia?
Yeah, it's an incredibly difficult and costly process for doctors who've been trained overseas who want to work in Australia. Now, it can take up to 18 months to 2 years to actually go through all the paperwork, and it's really onerous. And at the moment, we've got a market where people want to come and work here and work in rural Australia, and it's just incredibly difficult.
So it's a very difficult process at the moment. How can this be made easier?
Yeah, so at the moment, we've got all these hoops in place, and, what happens is these doctors have to fill in one piece of paperwork, send it off, and get it back, and then it goes to the next person. So it happens sequentially. So we're asking to make sure that we all work together to see what can we all do to cut the red tape, to reduce the amount, but also what can we all do at the same time to, reduce the burden on these doctors.
So what is the major consequence of the slow application process, and what would be the goal of an inquiry into this process?
Yeah, so there is an inquiry underway at the moment, and really we're competing against other countries such as New Zealand and Canada, and it takes 3 months to go and work in those countries compared to 18 months, 2 years here. So we're really, losing these doctors who would like to work in Australia. And look, it's not just doctors, it's also other health professionals such as nurses and pharmacists as well, because as you know, we've got a workforce shortage across the whole healthcare sector. So anything that we can do to make Australia an even more attractive place to work is going to be needed.
Do GPs favour working in cities as opposed to rural areas?
It's always been a challenge to get doctors to work in rural and regional Australia. The other challenge is, at the moment, getting medical graduates to train in general practice. So when I was going through, about 40-50% of the medical graduates became GPs. We know that between 14 and 18% at present. And I think what's happened now with the budget and the reprioritisation of general practice and primary healthcare, hopefully we can shift some of those numbers with the doctors coming into the system, but we also need to look at those wanting to come in from overseas as well, because it takes a little while to grow our own.
So how can we incentivise rural opportunities for these doctors? Does it need to be incentivised, or does the processing system simply need to be made easier? Is that the biggest incentive that can be offered?
Yeah, it's a bit of everything. So there's a pipeline, and that is from when we get our medical students come through. We need to expose them to rural practice right from the start, from those first couple of years, and then also make sure they have those good experience throughout their training. We also then, once they finish their 6 years, make sure that they still have opportunities to work in, well, firstly general practice, but also in rural practice in those early years. The tricky bit is that for Australian graduates, the average age of a registrar, so a GP in training, is 32, 33. And by that time, many of them have already got established lives. 2/3 of our registrars are women, so they're in in time of building families. So we really need to get those people early in their journey. For those who are coming in from overseas, we really just need to cut the red tape and make it less expensive. It can cost people up to $25,000 just the fees to be able to, for each bit of paperwork that they're submitting.
So with all the red tape that graduates need to get through just to be able to practice in Australia, would you say rural health is the big loser in all this? Is rural health losing out more than healthcare in major cities?
Absolutely. Rural Australia has been dependent on international medical graduates for workforce. And we're so grateful for those doctors who've supported our communities. What's happened through COVID when, that tap got turned off and now we've got doctors really want to come and work in Australia. We just simply, it's so slow. We're also, a lot of doctors are, I'm going to say, fleeing the NHS in the UK at the moment as well, because their system's in a lot of difficulty. So there's a lot of doctors around who want to come and work in Australia. We've just got to make it easier.
Dr. Nicole Higgins, President of the Royal Australian College of General Practitioners, making some excellent points there and giving us a good bit of knowledge on how difficult the process is for general practitioners who want to practice their craft in rural areas and how difficult it can be. Dr. Higgins, thank you very much for joining us today.
Pleasure, Dan. And can I say, as somebody who grew up rurally, who practices regionally, it is the most wonderful career and I would not do anything else.